You went to bed proud of yourself. A good dinner, steamed vegetables, a salad, maybe some beet juice for your circulation. No fried food, no sugar, just clean, healthy choices, the kind your doctor would approve of. And then you woke up, and something was wrong.
Something's not right. What is that?
Your words wouldn't come out right. One arm felt heavy. The room tilted when you tried to sit up. In my neurology clinic, I've seen this pattern more times than I care to count. A patient arrives, not because they were careless with their health, but because they were careful, eating what they believed were the right foods. And one of those foods quietly set the conditions for a stroke while they slept. Here's what I want you to understand before we go any further. This is not about fear, it's about biology. After 60, your body processes food differently than it did at 40. And some of the vegetables you trust most can work against your brain in ways that nobody warns you about. Today we're going through 9 of them. I'll tell you exactly what's happening inside your body, and I'll show you how to keep eating these foods safely. Stay with me until the end, because the last vegetable on this list is one most seniors eat every single week, and it may be the most dangerous of all. Let's start with a vegetable you've probably been told is your best friend. Vegetable number 9, spinach. Spinach has been praised as a superfood for decades, and honestly, that reputation is mostly deserved. It's packed with iron, magnesium, nitrates, folate. In the right context, it genuinely supports brain and cardiovascular health. But here's what most people over 60 are never told. Spinach is extraordinarily high in vitamin K, and vitamin K is the nutrient that tells your body to clot. It activates the proteins your blood needs to thicken, to seal wounds, to stop bleeding. In a healthy body without medication, that's a good thing. The problem begins when you're taking a blood thinner. Warfarin, Coumadin. These medications are prescribed to millions of seniors every year, often for atrial fibrillation or after a cardiovascular event. They work by blocking vitamin K's clotting signal. That's the whole mechanism. Warfarin suppresses vitamin K, so your blood stays thin and flows freely. Now imagine eating a large spinach salad, or a green smoothie loaded with 2 big handfuls of raw spinach. You've just flooded your system with the exact nutrient your medication is trying to suppress. Think of it like this. Your blood thinner is the brake pedal, and vitamin K is pressure pushing back against it. A little vitamin K, consistent every day, and your doctor can calibrate your dose around it. But a sudden large spike, from a big salad one night, then nothing for a week, then a smoothie the next. That inconsistency throws the entire balance off without any symptoms to warn you. Your INR level, which measures how well your blood thinner is working, can swing dangerously from one day to the next. When it drops too low, your blood thickens, and in the narrow vessels that feed your brain, thickened blood doesn't need much of an opening to stall. That's when a small clot forms, and it does it quietly, without a single warning sign. I had a patient, a retired teacher, sharp woman, meticulous about her health. She took her warfarin every evening without fail, and every evening she also ate a spinach salad because she believed it was helping her heart. Her dose had been adjusted once or twice, but no one had connected the dietary pattern to her fluctuating INR. One morning, her husband found her unable to speak clearly. Her right side was weak. The scans showed an ischemic stroke, modest in size, but located in a region that affected her language. Her INR the night before had been low. The spinach hadn't poisoned her. It had simply tipped the balance at the wrong moment. Here's what you need to take from this. If you're on warfarin or any blood thinner, the goal is not to eliminate spinach. The goal is consistency. Eat the same amount of vitamin K-rich greens every day so your doctor can calibrate your medication around a stable baseline. Never binge on spinach one day and avoid it entirely the next. Never load up on raw spinach smoothies without checking your INR first. And always, always, tell your prescribing physician exactly what you eat regularly. Your food and your medication are in constant conversation inside your body. The safer you want to be, the more fluent that conversation needs to become. But the next vegetable on this list has nothing to do with medication. It doesn't thicken your blood, it does the opposite, and that's exactly what makes it so easy to miss. Vegetable number 8, beets. Beets have a genuinely impressive reputation. The science behind them is real. Beets are rich in dietary nitrates, which your body converts to nitric oxide, a molecule that relaxes the walls of your blood vessels, widens them, and allows blood to flow more freely. That lowers blood pressure. It improves circulation. For a healthy adult with no medication in the picture, beets can be a legitimate ally for cardiovascular health. But here is what very few doctors take the time to explain to their older patients. When you are already taking blood pressure medication, and a significant portion of adults over 60 are, adding beets to your evening routine creates a compounding effect your body may not be able to safely absorb. Think of it this way. Your medication is already doing the job of relaxing and widening your blood vessels. It's already pushing your pressure down to a controlled range. Then you drink a glass of beet juice at night, or eat a generous portion of roasted beets with dinner. Now you've added another powerful vasodilator on top of a drug that's already vasodilating. Your pressure doesn't just drop to the healthy range, it can overshoot. It can drop further than your brain expects. And here is what happens when pressure falls too low overnight. Flow slows. The smallest vessels feeding the deepest brain tissue are the first to feel it, and slow-moving blood pools and pooled blood clots. This is the paradox that catches so many seniors off guard. They're not eating beets because they want to raise their stroke risk. They're eating beets because someone told them it was heart healthy. And it is, in the right context. But low blood pressure is not the same as healthy blood pressure. The brain needs sufficient pressure to drive blood upward through narrowed and stiffened arteries all night long while you sleep. The timing trap makes this worse. If you're taking your evening blood pressure medication and then adding beet juice later in the same evening, both effects overlap, and there is no alarm, no symptom, nothing to tell you that your pressure has dropped further than your brain can safely absorb. I think of a retired nurse who came to me after her husband found her collapsed in the bedroom doorway. She was a meticulous woman. She understood pharmacology. She tracked her blood pressure every morning. What she hadn't realized was that drinking beet juice every evening after her medication was creating a nocturnal pressure drop that her morning readings never captured, because by morning the effect had worn off. Her cerebellar stroke was small, but it stole her balance, permanently. She told me afterward, quietly, that she had been drinking that beet juice specifically to protect her brain. So what do you do if you love beets? You don't have to give them up, but you do need to respect the timing. Eat beets earlier in the day when your blood pressure is naturally higher and your body has more capacity to regulate the shift. Never pair them with your evening blood pressure medication. Keep portions modest. A half cup of cooked beets is very different from a full glass of concentrated juice. And tell your doctor you're eating them regularly so they can factor it into how they monitor your pressure. Beets are not your enemy, but your body after 60 no longer has the same margin for error it once did. What dilates and protects in one context can undershoot and endanger in another. Now here's where it gets interesting, because the next vegetable doesn't affect your pressure or your medication at all. It works against your brain in a completely different way, and most people have no idea it's happening. Vegetable number 7, kale. Kale is in everything right now. Every smoothie bar, every senior wellness plan, every anti-aging cookbook has it front and center. And I understand why. It's genuinely nutrient-dense. It has fiber, antioxidants, calcium, vitamin C. If you picked up a health magazine in the last decade, kale was probably on the cover. But there is something about kale that almost nobody talks about when they're recommending it to older adults. And it's not a fringe concern. It's basic thyroid biology. Raw kale belongs to a family of vegetables called cruciferous plants, the same family as broccoli, cabbage, and Brussels sprouts. These plants contain naturally occurring compounds called goitrogens. That word comes from goiter, which is the swelling of the thyroid gland. Goitrogens interfere with a very specific process. They block your thyroid's ability to absorb iodine. Here's why that matters. Your thyroid is essentially the metabolic governor of your entire body. It regulates how fast your cells work, how efficiently your heart pumps, how your cholesterol behaves, how your blood moves. When the thyroid slows down, even slightly, even subclinically, a cascade of changes follows. Your metabolism weakens, your cholesterol rises, your blood becomes more viscous, meaning thicker and slower moving, and your circulation, including the delicate circulation inside your brain, becomes less stable. In younger adults with robust thyroid function, moderate goitrogen exposure from cooked cruciferous vegetables is handled without much difficulty. The thyroid compensates, the body adapts. But after 60, thyroid function naturally declines in many people. Subclinical hypothyroidism, meaning mild thyroid slowing that doesn't yet show up as a formal diagnosis, is surprisingly common in older adults, and a significant number of people have it without knowing. Now add to that a daily raw kale smoothie, delivering a concentrated goitrogen load straight into a system that's already working harder to keep up. This doesn't happen overnight in one sitting. That's important to understand. This is not an acute reaction. It's a slow accumulation. Weeks of daily raw kale smoothies, months of a slightly suppressed thyroid, and the vascular consequences quietly build in the background. Rising cholesterol, stiffening arteries, blood that moves just a little more slowly than it should. And then one night, the conditions that have been building for months are right. Blood is thick. Circulation is slow. A narrow cerebral vessel that was already compromised reaches its limit. I worked with a patient who had been starting every morning for over a year with a large raw kale smoothie. Kale, spinach, almond milk, a scoop of protein powder. She was committed to it. She believed she was doing everything right. For the first few months, she felt energetic. Then came the fatigue she blamed on aging. Then the foggy thinking she chalked up to stress. Then some unexplained weight gain. Then one afternoon, she stumbled in her kitchen, her right hand suddenly weak and uncoordinated. Her thyroid levels, when we tested them, were low. Her cholesterol had climbed significantly from her last panel. Imaging showed a small ischemic stroke. The clot had formed in one of the small branches feeding her brain's language region. The connection between her daily smoothie habit and her stroke wasn't a straight line. It was a slow curve, but it was a real one. Here is what you need to know if kale is a regular part of your diet. Cooking kale significantly reduces its goitrogen content, not to zero, but enough to make a real difference. Steaming, sautéing, roasting, any heat exposure helps. The danger is concentrated in the raw, daily, large-dose form that smoothies deliver so efficiently. If you've been feeling cold, tired, foggy, or gaining weight without a clear reason, ask your doctor to check your thyroid. And if you're already on thyroid medication, be especially careful about how much raw cruciferous vegetable you're consuming every day. Kale is not poison, but raw kale in large daily amounts, in a body that's already fighting to maintain thyroid balance, can quietly tip that balance in a direction your brain cannot afford. Everything we've talked about so far has involved fresh food, something you chose, prepared, believed in. The next one is different. It's something most people don't even think of as a choice. Vegetable number 6. Canned vegetables. Let me ask you something. When you picture a dangerous meal, what do you see? Fast food, probably. Maybe a plate of fried chicken. Something greasy, processed, obviously unhealthy. You almost certainly don't picture a can of green beans. But for a significant number of seniors I've seen in my clinic, canned vegetables have been one of the most consistent dietary factors in the background of their cardiovascular decline. Not because vegetables are bad, because of what's been done to them before they reach your pantry shelf. A single standard can of vegetables, green beans, corn, mixed vegetables, tomato-based soup, can contain anywhere from 700 to over 900 milligrams of sodium per serving. That's more than a third of the recommended daily limit in one sitting. And many people eat more than one serving. They rinse nothing. They check no label. Because it's a vegetable, it couldn't possibly be the problem. Here is the biology, and I want you to follow this carefully because it explains a lot. When you consume excess sodium, your bloodstream pulls water from surrounding tissue to dilute it. That's the body's immediate response. It's trying to maintain balance. But here's the consequence. Your blood volume increases, and your blood becomes denser, thicker, more viscous. And that thicker blood has to move through your arteries under greater pressure. In a younger body, the arterial walls flex. They expand to accommodate the increased pressure and volume. The kidneys work efficiently to filter out the excess sodium over several hours, and the system restores itself. After 60, neither of those compensations works as well. The kidneys slow down. They don't clear excess sodium at the same rate. The arterial walls have lost elasticity. They've stiffened with age, with plaque, with years of accumulated wear. So the pressure doesn't dissipate as quickly. It sits, it builds, and it strains those vessel walls from the inside, especially the smallest ones, the cerebral arterioles threading through the deep tissue of your brain. Over time, that repeated pressure stress causes microscopic damage to the vessel lining. The body responds to that damage the way it responds to any injury. It sends repair signals, clotting factors, platelets. It tries to patch the cracks. And in that repair process, clots form. Small ones at first, invisible, unfelt. But the overnight window is when this becomes acutely dangerous. You eat a high-sodium dinner, maybe a warm bowl of canned soup, some canned green beans on the side, perfectly virtuous by appearance. You take your evening medications. You go to bed. And over the next several hours, while you're lying still and barely conscious, your circulation slows the way it naturally does during sleep. Your blood, already thicker from the sodium load, moves more sluggishly. Your blood pressure drops with your circadian rhythm, but not smoothly. It's fighting against the arterial stiffness and increased viscosity at the same time. That combination, in the narrowest vessels feeding the most sensitive regions of your brain, is where strokes are born. This pattern tends to build quietly over months, which is exactly what makes it so easy to miss. Blood pressure climbs gradually. 150, then 160, then 170. And because there's no single dramatic event, no obvious dietary culprit, no pain or warning, people adapt to the creeping baseline. They feel a little more tired than usual, maybe some heaviness in the mornings. And then one day, the vessel that has been under sustained pressure for 6 months reaches a point it cannot recover from. What makes this particularly difficult is that the person is usually doing everything else right. They're not eating fast food. They're not skipping medications. They genuinely believe they're making sound choices. The label says vegetables. That's supposed to be enough. So here's what I want you to do. Start reading labels on canned goods, specifically the sodium content per serving. Look for low sodium or no salt added options, which exist for nearly every canned vegetable category. When you do use standard canned vegetables, drain and rinse them under cold water before cooking. This removes a meaningful portion of the surface sodium. Even better, keep a stock of unsalted frozen vegetables, which preserve nutrients without the preservation chemistry. Your brain depends on smooth, steady circulation. High sodium doesn't just raise a number on a monitor, it physically changes the consistency of your blood. And if canned vegetables surprised you, the next one will too, because it's sitting fresh in your crisper drawer right now. Vegetable number 5, raw carrots. Raw carrots. Crunchy, low-calorie, praised for beta-carotene and eye health. They're the guilt-free snack that gets recommended in every senior wellness guide, every diabetic-friendly meal plan, every conversation about healthy evening habits. People keep a bag in the fridge and reach for them at night instead of chips or crackers, feeling genuinely good about that choice. And in many ways, that instinct is right. Carrots are nutritious. They have real value. But there's something happening when you eat them raw, alone, and in the evening that most people never hear about. And it has nothing to do with what you'd normally worry about. Raw carrots digest quickly. Because they're high in natural sugars and relatively low in fat and protein, they send a fairly rapid pulse of glucose into your bloodstream. Not as sharp as candy or white bread, but faster than most people expect from a vegetable. In a younger adult with healthy insulin sensitivity, the body handles that pulse smoothly. Insulin rises, blood sugar normalizes, the whole transaction is over in an hour. After 60, that transaction gets messier. Insulin response slows with age. The pancreas doesn't fire as quickly or as precisely. So blood sugar from an evening snack of raw carrots rises, lingers longer than it should, and then, in the hours after you fall asleep, begins to fall. Not always dramatically, but enough. Enough for the body to register a glucose dip and respond the way it always does when it senses that something is wrong, with stress hormones. Cortisol and adrenaline. Released in the middle of the night while you're asleep, without your knowledge. These are not gentle chemicals. They are your body's emergency response team. When they activate, they tighten blood vessels. They raise blood pressure. They shift your blood chemistry toward a state of readiness, because evolutionarily, a blood sugar drop meant danger, and your body responds accordingly. What that means practically, in a 70-year-old with already stiffened arteries and slowed circulation, is a sudden nocturnal pressure surge inside vessels that aren't built to handle it gracefully anymore. Now layer in the dehydration factor. Most seniors go to bed mildly dehydrated. Not dramatically, just the natural consequence of reduced thirst sensation and an aging kidney that doesn't signal fluid needs as efficiently. Mild dehydration thickens the blood, and thicker blood, moving through constricted vessels under pressure surges from stress hormones, in the slowest circulation window of the entire 24-hour cycle. That is, the environment where small clots form. This is exactly the chain of events that can unfold after something as innocent as a handful of raw carrots before bed. I had a patient, a retired nurse actually, someone who understood the body well, who had replaced all her evening snacks with raw vegetables, primarily carrots. She was proud of it. She told me it was the one change she'd been able to stick with. But she started having mornings where she woke up dizzy, mildly confused, once unable to remember how to work the coffee maker she'd used for decades. By the time she came to me, imaging showed microclotting in several small cerebral vessels. Her glucose patterns overnight were swinging in exactly the way I've described. The carrots weren't the only factor, but they were the consistent trigger nobody had looked at. She told me, quietly, that she'd never imagined carrots could be part of that story. The solution here is simple and genuinely easy to implement. Never eat raw carrots alone as your last food before bed. If you want them as a snack, eat them earlier in the day, and always pair them with protein or a healthy fat, hummus, a boiled egg, some nut butter. Something that slows that glucose absorption and prevents the downstream spike and crash cycle. Your blood sugar at night should be stable and quiet. Your brain does its most important repair work during sleep, and it cannot do that work well if your body is managing a hormonal emergency at the same time.